Hi there, welcome back to Bio World. In today's video, we're going to talk about dengue. Of course, I've introduced dengue in my previous video where I discussed dengue versus malaria, and it is in that video where I had already introduced to you the vector that causes dengue, that is Aedes aegypti, and the microorganism that causes dengue, the virus from the genus Flavivirus. In that video, I've also told you that it is the infected female Aedes aegypti that transmits the disease, whereby once it bites a person, after a period of almost 7 days, symptoms begin to appear. Symptoms such as the high fever at temperatures reaching 41 degrees Celsius and physical symptoms such as PTK, as well as more serious symptoms like dengue hemorrhagic fever and dengue shock syndrome. After which, if the individual's immune system is powerful, the individual will recover. But first, let's have a look at our STPM syllabus. Today's video is about 13.2 dengue, part B, explaining the transmission of dengue. How does a mosquito become infected? The story has to start with an infected patient. Patients with dengue will have flavivirus in their blood. Flavivirus is the virus that causes dengue. Now, in the daytime, Aedes aegypti come out to bite. Now, if they happen to bite an infected patient, the flavivirus will be transported along with the blood into the mosquito's stomach. Then, when this infected mosquito flies and bites a healthy person, the mosquito will spit saliva into the healthy person's blood circulation, mainly to prevent the blood from clotting so that it continues to suck the blood. But in that process, what happens is the virus will be transported into the healthy person's circulation. In the healthy person's bloodstream, these flavivirus will travel to the leukocytes. Then, in the leukocytes, these flavivirus will reproduce. They will increase their population. As a response to this, what happens is the monocytes and the macrophages will begin to synthesize cytokines. The original role of cytokine is to trigger fever. Added to that, the cytokine also causes the blood capillaries to become fragile. Now, this is what happens during what we call as a primary dengue infection. It means the patient is being infected by the flavivirus for the first time. Now, let's find out what is the benefit of triggering a fever. The role of a fever is firstly to inhibit the reproduction of virus. And at the same time, the high body temperature actually promotes mitosis of the leukocytes as an immune response. Unfortunately, the side effect is that the blood capillaries become fragile. When the blood capillaries become fragile, plasma leakage occurs. There is a slow release of the blood out of the blood capillaries, also known as capillary leakage. Now, when there is capillary leakage, it starts to appear on the surface of the skin in the form of a skin rash, which is medically called PTK. Of course, I don't know if I'm pronouncing it correctly though. So far in our discussion, it appears as if dengue infections are not really lethal because patients can recover with a strong immune system. However, we find that if the patient is infected the second time around with a different type of flavivirus, then it may lead to death. Let me tell you more. If you are infected for the second time, we call that a secondary dengue infection, meaning that in the first infection, let's say for example, this yellow virus, this yellow flavivirus, we call as Dengue 1. Okay, Dengue is actually the term used to represent dengue virus serotype 1. Now let's say you are being bitten once again, but this time the flavivirus that enter is of a different serotype. The green color ones here, let's say, are from the serotype Dengue 2. Okay, then the problem starts. What happens is our immune system will overreact because it does recognize that this is flavivirus. But because it is of a different serotype, we find that the immune system works harder. What do I mean by work harder? It produces excess cytokines. So as you know, small amounts of cytokines already make the blood vessel fragile. But when there are large amounts, the effect is more complicated. The excess cytokines now will increase the permeability of the blood vessels. So as you can see now, there are bigger ruptures, and this will cause large amounts of the plasma to leak out from the blood vessel. So we call this as vascular leakage. When there is vascular leakage, what happens is the blood pressure begins to reduce. Now, when our blood pressure is less, the major organs of our body do not receive sufficient blood. So our organs begin to fail. One of the organs involved is our bone marrow. So now the bone marrow is not producing sufficient platelets. Platelets are necessary for blood clotting to happen. So since we don't have enough platelets, excessive bleeding occurs, which we call as hemorrhage. So organ failure added with all this hemorrhage will lead to death. So this situation is what we call as dengue hemorrhagic fever, DHF, or dengue shock syndrome, DSS. So remember, this only occurs upon a secondary infection involving a different serotype. There are altogether 4 serotypes: Dengue 1, Dengue 2, Dengue 3, and Dengue 4. So in conclusion, you can see that death by dengue is not actually caused directly by the flavivirus, but caused by our overactive immune system. So that's all I have about dengue. In my next video, I'll talk about malaria transmission. Until then, bye-bye.